Chapman, and I'm the president of the board of Healthy Northern Kennebec. And I'd like to give the Muskie Center a round of applause for this wonderful, the food and the atmosphere. It's been fantastic. And how about a round of applause for the Old Blues Cats band? We wouldn't be here tonight if it weren't for the support of some foundations. The Maine Health Access Foundation, the Sewell Foundation, and of course SCALE, which you're going to be hearing about, but that's through the Institute of Healthcare Improvement and funded through the Robert Wood Johnson Foundation. So on behalf of the Healthy Northern Kennebec Board and our coalition, I just wanted to say how excited and proud we are of the Healthy Waterville initiative. Our goal is to help create a more connected community where healthy food choices are available for all. The Healthy Waterville initiative has really challenged us as a community to be more empathetic of each other's circumstances and to bring health and social equity into our conversations and planning and to be more intentional about our collaborative work. It's highlighted how necessary it is for community members to be empowered and involved as leaders and advocates around health, access to healthy food, and being part of the fabric of our Waterville community. So it's my great pleasure to introduce our special guest speaker, Dr. Shoma Stout of the Institute for Healthcare Improvement and 100 Million Healthier Lives. Dr. Shoma Stout, I'm sorry, I knew I was going to do that too. Shoma Stout is the Executive External Lead for Health Improvement for the Institute for Healthcare Improvement and serves as Executive Lead of 100 Million Healthier Lives, which brings together hundreds of partners across communities to support 100 million people globally to live healthier lives by 2020. She also directs the Innovation Fellows Program at the Harvard Medical School Center for Primary Care and is lead transformational advisor at the Cambridge Health Alliance, CHA. Dr. Stout is deeply committed to improving the health and well-being of underserved people and communities and has worked as a primary care doctor in the safety net for over 15 years. Previously, she served as Vice President for Patient-Centered Medical Home Development at CHA, where she led a whole system transformation that garnered numerous national awards for achieving breakthrough results in the Triple Aim. In 2002, she was awarded the Robert Wood Johnson Foundation Young Leader Award for her contributions to improving the health of the nation. Please give a warm and welcoming round of applause for Dr. Shoma Stout.
Good evening, everyone. What should I do differently? Off is good. Is that okay? Perfect. Can everybody hear me well enough?
We're going to listen really carefully to Shoma, okay? Is this microphone?
Try it.
So, first of all, I just wanted to begin by saying what a pleasure it is to be here in Waterville today. Can you imagine why it might be such a pleasure to be here? Why do you think it is?
It's a great place.
It's a fabulous place. What else?
I have another microphone.
Thank you.
Try that.
Hi. Why else might I be so excited to be here today?
It's a nice day out.
It's a beautiful day out, but I could have been at the beach. What else?
Then you wouldn't have met all these wonderful people.
Well, the people.
I wouldn't have met all these wonderful people. And that's exactly right. You know, you can walk into a room and know when there's a community in place and when there isn't. And to me, one of the most important things that's needed for health and well-being to flourish in our country is actually community. And so it's such a pleasure to be able to just for a little bit visit and join in on your community celebration today. And I thank you for having me here. I'm here with some friends. Over there are Laura Howell, Sarah Breslin, and Kellyanne Johnson. They're part of our team. And when they learned that I was invited to go to Waterville, they all said, well, can we come too? Because they've heard so many stories about Waterville. You may not know this, but Waterville, Maine has become famous in 100 Million Healthier Lives. And it's become famous for two reasons. The first is because it's got the nicest people probably in the entire world who are representing your community, led by Fran Mullen. So I just wanted to, everybody just give a huge round of applause for Fran. And all the people working, and you guys just embody it. Every time you guys show up someplace, every time they represent you outside your community, they bring this sense and spirit of what it means to be community with them, and it shows. And the second is because they're doing such meaningful, important work that is about exactly what people need, and that shows what it means to be a community together. And so I just want to thank you for helping me to come and get a deeper dive into what that looks like, and for sending your team out into the world so that they can help teach. And Dan, I remember sitting with Dan and Fran for 2 hours until midnight in, where were we? Were we in Oklahoma City? Yes, in Oklahoma City, trying to think about the health and well-being of Waterville, because that's how passionate they are about it, that they stay up till midnight. In times, you think conferences, as you go and you enjoy, you're having drinks or whatever, they were doing hardcore work and thinking about how to help Waterville thrive in that time. Can I have the next slide, or a slide advancer? So before we go from this last one, sorry, go back one. So for those of you who don't know it, 100 Million Healthier Lives is really an invitation to be part of a global challenge that says, you know, all of us are trying to make our communities better. What if we were able to put our efforts together? What if together we could help 100 million people live healthier lives by 2020? If we were going to do that, we know that it's not going to be enough just to improve someone's physical health, right? No, we do need to eat well, and we do need to have exercise, we need to see our doctors. There's all kinds of things we need to do to be physically healthy. But what we also know is that most of what creates health and well-being isn't actually your physical health alone. It's actually all the other dimensions of health, and even who has access to the things that create well-being. So I hope you'll give me a few moments to talk about that today. The next slide. We say that through unprecedented collaboration, innovative improvement, and changing the system that is broken, we can begin to help 100 million people live healthier lives by 2020. How many lives are getting better here in Waterville? Do you know?
16,000.
16,000.
All of them.
All of them. So what would it take for that to happen? And so that idea of what does it take for everyone to be thriving, and what for us to be thriving together, and to be learning, just as you create change in one place, for that bright spot to go and be seen across the country. And as somebody who's in Oklahoma figures out something that might be relevant in Waterville that comes back, that's really what that unprecedented collaboration is all about. It's for us not to be learning alone, but to be learning together, and to know that our actions make a difference in our local community and in the world. Next slide. I'm just going to share with you a few stories. The good news is I'm not going to be giving an academic discussion. I mainly have the slides so you can see the pictures. This is a slide of one of the places that I think of as one of the most innovative places for creating health in the entire world. This is in a rural community in Guyana, in South America, in the second poorest country, in the second poorest region of that country. And I would say that this community reminds me in some ways of Waterville, not because you're the second poorest or anything like that, but because the ability of the people in Guyana to see and know that they are a community, that their fate is bound in one another's, and that when you need to improve health, if what you need to do is improve education, that's what you do. It's that ability to make decisions because you're a part of a community together that set them apart. And this community began with, no roads and no, they didn't have phones. Can you imagine that? No phones. Under these trees, those mango trees, people would gather as a community and think how to improve the health of their community. And at first, people thought, we'll teach people, we'll educate people. And so people taught the public health messages, and all of that was helpful. It made things better. Next slide. They began to get people together in community meetings just like this. They didn't have this cool, building, so they had thatched huts. They built that thatched huts as a community center. It's kind of interesting to think that they're doing the same kinds of things. But they would come together, and they would gather together and learn together. Next slide. Over time, they realized that it wasn't just going to be enough to gather together. They needed to begin to build the leadership and capacity of the people there. They began having teams of villagers and community health workers and teachers as teams go out to try to improve the health of their community. And the organization that was walking with them helped support them to do that. And you began to see really different leaders emerging. Suddenly women became leaders that had been housewives before but had ideas of what to do. They took leadership and they began to move forward. So this idea of unexpected leaders arising and creating abundance in a community began to grow from that. That it wasn't just about that when they saw themselves, they didn't see themselves as poor. They saw themselves as rich with people who were able to make a difference in their community. Next slide. I wanted to introduce you to Eugene Mccain. He's one of my heroes around the world. Now, Eugene only had a 5th grade education when we met him. He was a community health worker and was absolutely brilliant. And what we learned as Eugene and his friends, these teams of community health workers, villagers, and teachers began to learn what it meant to improve the health of their community, to look at their data, to use their data to guide their improvement, but also their know-how of what actually works in their community to guide things. They began creating the most brilliant solutions. Eugene was able to lower the incidence of malaria in his village by 90% in 1 year. Can you imagine that? 90%, while at the same time eliminating malnutrition among widows. Can you imagine that? How many people can say that they've done that? And this spread throughout. You know what he did? He did something that only he could have done. He knew that the widows couldn't make it farming alone, so that's why they were starving during the winter. Farming was a 2-person job. You needed both people. He got the women to stop farming, which requires a huge amount of trust, right? And got them to form a sewing cooperative and weave mosquito nets and trade it to their fellow villagers for food. The villagers knew about malaria. It was ravaging them. 80% of them got malaria every year. Think about that, 80%. But they knew about mosquito nets, but they couldn't afford them. And so by doing this simple thing, by looking at the data in his community, by having his know-how, he was able to transform the health of his community. Next slide. Here's another community health worker who was able to eliminate, actually do the most important thing that children need for social and emotional resilience, which is interaction with their parents. He was able to actually use that to eliminate acquired developmental delay in the entire region. So, how many people are working on resiliency for children? Or have children that you care about them being resilient? Right? So, he was able to do that by starting nursery schools. Such a simple thing, not a big, complicated thing, but he had the mothers there, and he taught the mothers to play with their kids in a different way, using the things that were local to that area. Next slide. And then as they began to do this, as they began to think about the fact that every single person in their community could be a leader, they got the youth involved. And the youth began to get the other youth involved. And as they taught these youth the skills that they needed to improve the health of their community, but also charged them to do that, these youth single-handedly turned the tide of the HIV epidemic in Guyana, which was, at that time, the 3rd leading cause of death for youth between 13 and 30. Next slide. So, what can you learn from this story? I learned a lot of things, and I'm just wondering, actually, go back a slide. Hopefully you haven't sped read through that. What do you get when you hear that story? What do you think about? else?
People can do wonders when they work together.
People can do wonders when they work together. What else?
That no matter who you are, you make a difference.
That no matter who you are, you can make a difference. Absolutely. What else?
That they can all come together as one, as a community.
They can all come together as one, as a community, right?
And young people have something to offer the community.
Young people have something to offer the community, in fact, a lot to offer the community. Great. Anyone else?
Solve really.
It's important to know your resources and to think about them differently, right? Not resources are just things that come from them to us, but actually things that we all possess. What does it mean to put them together? What else?
You can solve really large problems in your community by stepping back and thinking about them.
By stepping back and what?
Thinking about them.
So you can solve really big problems in your community by stepping back and thinking about them. Exactly. So you guys are absolutely right on the money. So, yes?
And I like the way, I forget the gentleman's name, the way he looked at what other people needed. You know, not so much just know what you need, but look at what other people needed, and what they did was somewhat of some type of a swap.
That's right.
And I like that idea.
Right. So sometimes it's funny. We always think about, helping each other as quid pro quo. I help you, you help me. That's one piece of it. But sometimes in a community, what's needed is I help you, you help him, he helps her, and you help me. And that's true at organizations working together in a community, but also for people working together in a community. And learning to think in that culture of what we call that mindset of abundance is, I think, one of the most important things we need to do if we're going to get out of the current way things are and into a new space of being able to get to 100 million healthier lives. And as part of that abundance, I'm inviting you to be part of that abundance together because we believe that the real solutions will come from communities just like Waterville. And if those communities aren't alone, if they see themselves as connected together, if the leadership can come from anywhere, including the people with lived experience who are experiencing what's actually happening, then suddenly we begin to see real change happen, especially when they're then supported by leaders who are able to do that. And in this room, one of the things that I love is that I see leaders at every level, from the person whose life is most affected, all the way to a former mayor and a foundation leader, to coalition leaders, all together because you care about, and the health system leaders as well. Next slide. You guys got all this, so let's just skip to the next one. And I just wanted to have just this one quote that I personally love, and I wonder, can I invite you to read it? Right.
Abundance does not happen automatically. It's created when we have the sense to choose community, to come together to celebrate and share our common store. Whether the scarce resource is money, or love, or power, or words, the true law of life is that we generate more of whatever seems scarce by trusting its supply and passing it around. Authentic abundance does not lie in secured stockpiles of food, or cash, or influence, or affection, but in belonging to a community where we can give those goods to others who need them, and receive them from others when we're in need. Parker Palmer, let your life speak.
Are there any words that stand out for you in that quote?
What stood out for me is that abundance is shared in the community. It's selfish shared.
It's created when it's shared. Exactly. Anyone else?
Learning a lesson not to be fearful and trusting that if you give, you will receive. It's actually something that I know from the Bible.
learning to listen and to be trusting and not be fearful. Thank you. Yes.
It kind of reminds me of, because I'm a veteran myself, going out to war and fighting for everybody, everybody around the world, to let them know that every man is created equal, no matter who you are.
That's powerful.
Amen.
Thank you. Let's go to the next slide. In case you think that that's a soft science, or it can only work in a place that's this tiny place in Guyana that's a rural community, I just wanted to share with you some hard numbers. This is our work. Remember that long bio, which always embarrasses me when people read, but I appreciate that you need to know who I am. Remember, I was vice president of one of the Harvard health systems, and we used those same principles that they used in Guyana to create a whole system transformation of an entire healthcare system. We used the theory of abundance to change how the money flowed so that we could focus on improving the health of our community. And it was as we improved the health of our patients and the health of our community that we could take the savings from that and invest in it where it really mattered. In helping people connect to housing if that's what was needed, in supporting veterans to come together if that was needed, in bringing people together, and the kinds of community building connections that made a difference. This is just one example. By doing that, we were able to lower the hospitalization rate for our diabetics by 36%. Next slide. We realized, though, that while we could lower the hospitalization rate by 36%, do you remember that red line that was going up? That was the number of people who got diabetes during that same time. That doubled. That was kind of a big problem. Do you know how much we spend on diabetes today as a country? What would you guess?
Billions.
So you said trillions. Go
I
ahead.
said billion.
You said $1 billion? We could put a pot of money on this or something. What else? Anybody else? Any other guesses?
30 billion.
30 billion. We spend 322 billion. Right? Just for diabetes and pre-diabetes. Okay. Now take a deep breath. How much do you think we'll spend by 2020? Do you know what it's projected by the American Diabetes Association? If we do nothing? Triple that, double that? Well, the outlook is a little bit better. It's going to be $500 billion. What would you do with that extra cash? What would Waterville do with that extra cash? Right? I say that because we can't solve this problem by providing the best possible health care. We tried at Cambridge Health Alliance to do everything that we knew of to meet people where they were at, to create relationships, to think proactively, to do what became a best in the nation model according to Health and Human Services about how to deliver, for instance, great primary care, where people knew you by, where they say someone knows you by name. We knew people by name. We would call people up. We'd check in on them. It was great care, but it wasn't going to be enough. And I wanted to show you why. This is what people saw every single day when they went out into their communities. Smoked meats, sugary foods, it just wasn't, we just weren't going to be able to get it, because here's the truth. How many times, if you have, anybody here have diabetes?
So my wife does.
How many times do you see a doctor in a year? How many times do you see a doctor in a year?
Probably at least 4 or 5 times a year.
4 or 5 times. For how many minutes would you say you see the doctor?
An hour.
An hour, right? Great. So that's maybe 4 or 5 hours a year that you spend with your doctor. Do you know how many hours you spend managing your diabetes on your own at home? You don't have to count it. It's about 5,000 hours. So the thing is, what's happening for people in that 5,000 hours is way more important than just what we're doing, what's happening in those 4 hours are really important. We need to do the best possible job we can to prepare you in those 4 hours for the 5,000 hours. But if the rest of the time in that 5,000 hours, what you see is places that aren't places that support the healthy living of a community, it's going to be really hard for you to get there. Does that make sense? So where you live, where you work, where you play, all of us have to be part of creating a healthy environment together if we want to get some of that 500 billion back. Right? Next slide. That's what we're sharing with you from the American Diabetes Association. Next slide. Here, oh no, go back one. Can you go back one more? Oh, nope. The one after this. I'm just gonna. There was one in the middle of you know what? Well. Go. One more up. Oh, it's fine. We'll stay here. This is great. This is the next one. Yes, that one. The slide before was trying to say that you actually, what's interesting is that if you look at, some of you are working on adverse childhood events, it turns out that a child that is exposed to toxic stress between 0 and 5 will have a 40-fold higher risk of developing a chronic disease like diabetes when they're 50. So as a doctor, I can lower your risk by 2 times. It's not going to be enough if I'm just thinking that I'm going to be able to solve this alone as a doctor. We need lots of people working together to think about how we protect kids here. But here's another map that's interesting. What do those maps look like? What do you notice about those 2 maps? They look the same, right? So those dark areas are places on the right-hand side of children who are obese, who are overweight, or in Los Angeles County. On the left-hand side are people who are poor in Los Angeles County. Isn't that interesting? It turns out that most of what determines whether you end up as obese and then developing diabetes prematurely and dying prematurely is more determined by your social circumstances than actually your as I say, your zip code is more important than your genetic code. And once we realize that, we can begin to think differently. And we can realize that if we're thinking in abundance, we don't just have to think about what we can do, what I could do as a doctor in my primary care office, but actually think how we can work together in communities to support people so that they have better outcomes. And there's a lot of good science and genetics about it that I won't bore you with today. But just going on to the next slide. It turns out that in many communities, and I wonder if you've done this exercise, 2 children born 2 miles apart might have a 25-year gap in their life expectancy. One might live till they're 55, and one might live till they're 80. Does that seem right to you? And that's at birth, not anything they did, at birth. It has everything to do with where they'll grow up. And so one of the things we've said in 100 Million is that working on equity has to be all of our jobs. Because remember, the way that people are dying is by getting diabetes or heart disease. And that's part of that 300 to 500 billion. We can choose to ignore poverty, or we can address it. But if we choose to ignore it, we're likely to go bankrupt as a country. And even though you may not think of poverty as a health issue, it is. Poverty is a health issue that brings with it healthcare cost. And so it's just something that I invite you to think about. Next. I'm actually going to skip ahead to the slide with all the pictures. This is for, we'll stop here quickly. I just love showing pictures to you guys. But this is a picture that was drawn in case you think that this issue of thinking about whether our system is working is just limited to people who are poor. This was actually drawn by a mother who was in a pretty upper middle class family, but she had a child with a special health care need, her son Gabe. And she said, Shoma, let me draw you a picture of what happens to my son. On the left-hand side are all the people taking care of him in health care. And you all are working to make that better, and have a seat at the table, and things are getting better. His pediatric office is this one little bubble in there, and all the rest of them are all the other people. Most of them don't ever talk to each other. But if you really ask me where he's spending his time, his health is really being created at his school. And I wish just once a year, that's that red quadrant on the left. I just wish his pediatrician and his teacher would talk just once a year to think about what's happening to my child. But here on this right-hand side are all the supports our family needs. You may not think about our legal and financial team as part of the help, but actually that I've had to quit my job in order to be the full-time caregiver for my son and to coordinate all this because there's nobody who's doing that. And because of that, actually what I worry about is what's going to happen to us after I'm gone. Who's going to take care of Gabe and how is he going to survive? And that's why a legal team and all the supports, the family members who are supporting us are part of our network of support. And she said, what we need is to stop thinking of ourselves as a healthcare system and start thinking about how we create a health and well-being system. So I asked her, well, what does that mean? Next slide. And she said, well, there's the World Health Organization that says health is mental, physical, social, and social, and we added to that spiritual well-being. But she said, that's a picture of her, of Kristen. She said, but health isn't just the absence of disease. It's an addition of confidence, it's skills, it's knowing that you're making a difference in your community. But above all, it's a means to an end, which is a joyful, meaningful life. And really, 100 Million is all about inviting all of us to be a community that's helping to create joyful, meaningful lives for ourselves, for one another, and for our whole community. And so we say that there are 5 key shifts we need to make. The first is to go from a healthcare system to a health and well-being system. The second is to go from thinking in scarcity to thinking in abundance. The third is to take our work on equity to think of it as not just that we're doing good, but actually to recognize that this is something that should unite us across the aisle. Because actually we can no longer afford the cost of inequity, either in health outcomes or in cost. We need to go from pathology to vision to know that real change is possible. And we need to think about how we help communities of poverty become communities of solution, where they're creating the changes and are able to rise and grow the leaders, just as they did in Guyana. We go all the way to the end, to the last set of pictures. I just wanted to share with you, Waterville is one of the communities that's now a part of 100 Million Healthier Lives through the SCALE initiative. And as communities all over the country have begun to adopt these new ways of doing things, these new mindsets, these ways of looking and taking a step back and looking at the picture, they've begun creating innovative, beautiful solutions for how to create thriving lives for everyone. And I just wanted to share a few of those pictures and stories with you. On the left-hand side is Two Lakes Elementary School. The principal at Two Lakes Elementary School wondered if you could help all children who are in this predominantly poor African American community have the same educational attainment as kids much older. He trained up all the teachers in understanding race and racism and understanding structural pieces, but he did something more important. He said, I'm going to help these children see themselves as leaders from the beginning. Instead of giving them grades, he taught the students to assess themselves. They taught the students to assess themselves, and they supported the students in a trauma-informed way. They really understood where they were. These kids are above the state average in terms of their attainment now and climbing every single day. On the left-hand side is a community which has youth who have been imprisoned early on. Normally, their rate of going back into prison is about 60%. It costs about $40,000 to incarcerate someone. They actually keep going back in. We could have sent these kids to college at a much cheaper cost than sending them to a prison cell. UTEC has been able to find a way to reduce that rate from 60% of going back into prison down to 2%, and sustain that over 10 years. Change is possible. On the right-hand side is a school in Scotland where a teacher figured out how to eliminate overweight and obesity in the entire grades. You know what she did? She said these kids, they have twice a week PE. By the time they get out there to run, they can barely run. They're so out of shape. There was a dirt track outside the school, and she said, they're not paying attention to in class because they're tired. And so she began something called a daily mile. She just took her kids out, and they began running around. And what she noticed is that kids were more alert. And within a couple of months, they were just full of energy and able to easily run around that dirt track enough to run a mile. The other teachers began buzzing about this, and they began doing this. And as they did it across a whole grade, the nurse came and said, I can't believe what's happened. For the first time, we've gone from a 25% of kids being obese to none being obese or overweight in the entire grade. Such a simple thing, not created by some brain trust person over there, but by a teacher who is creating this change. This is now spreading to 60,000 kids all over Europe and now coming over to the US. And on the right hand, the very top, is a different way of thinking about the abundance of our seniors. Do you have seniors in Maine? We have seniors in Boston. In this case, most people think, it turns out that if you're isolated, if you're not socially connected, that's a bigger risk to your health than if you were smoking. Did you know that? Makes sense though, right? So mostly people think about helping seniors in social isolation. So the Palo Alto Hospital's Medical Foundation found that too. And what was interesting about what they did was that they took a very innovative solution to the problem. Rather than asking people who are working age to go visit the seniors, they actually made the seniors the abundant resource for the rest of the community. And I just wanted to share a quick video about how they did that.
It means new possibilities for me. I can give of myself and receive from others too.
A lot of people come and go, and this has now become an issue as I'm older. I was just thinking, my goodness, either they're dying or they're moving. And how do I meet people? And then when I realized that the whole idea was to help you be able to meet young and old people, that's what really interested me.
The reason I set up this particular exchange with the artwork is because I've had a box of my son's artwork sitting near my bed for years and never really put it up. I don't have any experience or knowledge about how to make a wall look really nice with art, so I needed some help.
I answered this exchange request because I had so much experience with art and hanging art and framing art over years and years, and I knew that I could help her hang the pictures and teach her some of the essentials so that she could do it on her own later.
The opportunity of getting together, the opportunity to exchange, you can afford it. It's not something that you go home saying, well, this is great, but I can't afford it. Well, you put some work in there and you can afford it.
It's not about charity. It's about giving someone the gift of allowing them to give to you, because we all feel so good when we're giving. If you are nothing but a giver, there's an entire side of life that you've now closed yourself off to. I think that we should be as open and able to receive as we are to give. And we become better at giving when we're able to receive as well.
You cook a good meal, and it's fine. You eat by yourself, and it's fine. But if you share it with somebody, it's another feeling altogether. It's so important to contribute to any kind of society that we're living in, or else you just kind of like dry out. And I feel like that is one of the secrets of being happy, is to give of yourself. And without that, it's like life is like half lived.
I was really kind of blown away. The time banking itself seemed like, wow, this is helping so many people. It seems like a small thing that once you get involved and invested in it, really can become incredibly powerful. I can't say enough good things about it. It's really been a wonderful influence in my life.
What's interesting about this story is the people that were paying for this was actually the hospital, because they knew that it was actually that social isolation that was going to drive their poor health outcomes in their patients. but it was the community that needed to come together, not just the people who are...
Welcome to the orientation for Linkages Community. We're thrilled that you're here.
Takes action fast. It's real. It's really the amazing, it's about being able to see that abundance in each other. And I hear this senior center is amazing at bringing people together. Is that right? At all ages. So, my friends, I just invite you to consider being part of creating abundance in our world. For ourselves, for our communities, for each other, and especially for those who aren't thriving in our community, whoever that is, right here in Waterville. I have a special request to you from the Surgeon General of the United States, who's asked all communities to think about coming together to address the opioid crisis. Is that an issue here?
Yeah.
So if any of you are interested in that, we've been supporting the Surgeon General to be able to bring communities together to take action. Let us know. But otherwise, we just invite you to know that you're not alone, that we are not alone, and that if we can create a community of solutions together all across the country, all across the world, together we'll begin to create the stories that help us see how we improve 100 million people's lives by 2020. And I'd love to see Waterville in one of these videos and to be able to share your story out in the world. Thank you all so much for having me.
I just wanted to share a little story. When we first applied to be a grantee for this project, we were just a little excited about it. And I think that our excitement was contagious. And one of the things that we did, the very first thing that we did is we went to a leadership academy in the Boston area. And so there was a group of, I think, 5 of us, and that was the first time that we had an opportunity to meet Shoma. And I just remember being at that leadership academy, and Jen Olson, where's Jen? There, she's right there. She looked at me, and I looked at her, and she said, "This is big." And I said, "Yes, it is." and we just had no idea at that point how magnificent this whole project and initiative was going to be, and being able to have colleagues across the country. We have some folks in Sitka, Alaska that are our partners in some of this work that we're doing, so it's just been amazing. So I want to invite our fabulous Fran up to help me thank Shoma for her words and her experience and her sharings today.
Thank you, Shoma. Who else was touched by what Shoma said? Yeah. Who else wants to join and help your Waterville project now? Who was thinking, this is something that we can do in our community, and this is something that we all can do, right? We have lots of ways to get involved. Talk to anybody here who's around the tables. There's lots of ways to get involved. Just by showing up today, just by coming, you started a process. You started getting involved. So thank you. Thank all of you for coming. And thank you, special Shoma Stout. We have a little gift for you from Waterville, so you can remember. Yes. We have a picture of the water in Waterville, and also a web, because we're all connected. We're connected with Shoma. We're connected across the country. We're connected to each other. And as you had your little passports, who still has a passport?
I was going to ask Dr.
Good. Yeah. Well, we're not done with our time yet. We have some more things that Tina wants to say, but we don't want you to leave quite yet, because there's plenty of food left. And we have some games. The passports are not all done yet. We want everyone to get a chance to do a survey for 100 million out their lives to see how are you doing, how are you feeling.
How's it going with you right now? And there's lots of opportunity to get involved, so please stick around. And we'll have prizes soon.
All right, so a couple of things that I wanted to mention. First of all, Fran, I'm going to ask you to come back up here for a second. So we wouldn't have been able to achieve what we've achieved so far without having Fran leading the Healthy Northern Kennebec Coalition. And Fran, I just have a little something for you to say thank you for everything that you've done. And we just found out that Fran and the Healthy Northern Kennebec Coalition has received a grant from the Sewell Foundation for this project for $106,000 to $120,000 to continue with this project.
We are not done here. This
is a celebration, and it's also like a commencement. It's like a beginning. So you're all here. We're going to keep this going, and we're going to keep going until we're all 16,000 of us as healthy as we can be.
That's right. Awesome. And Jen, would you please come up here for a moment? Jen Olson is the leader of our planning committee, and she has done an absolutely fabulous job, and we appreciate her so much. And the rest of the folks on our planning committee, if you could just raise your hands. Wanda is over there. Ryan, where's Ryan? Did he? He had to, oh, okay. Shh, he had to leave. Okay. Kelly helped us. Oh my gosh, we had so many folks helping us. It was awesome. Hunter's been fabulous. And our Healthy Northern Kennebec staff, sort of in the back there, Denise and Kelly and Jacqueline. Hunter's over there. Special thanks for Hunter. He just does all the stuff behind the scenes, and it's really kind of cool because whenever we need something, he just shows up out of nowhere. There he is, and then he's gone. So if you're interested in the Healthy Northern Kennebec Coalition, our next meeting is July 27th. We usually meet about a month. We have an educational program. We have a lot of fun. Fran likes to do like team building activities that are always very fun, and we pass around some sort of vegetable and everybody has to say something creative. So, and if you specifically would like to join the Healthy Waterville team, then you want to check out with Kelly. You want to check in with her, and she'll help you out with that. And we just want to inspire and invite you to keep caring and connecting in our community, building bridges. Stick around for more food, more fun, more music, and door prizes at the end. All right? Thank you.